Hello everyone, I am Bella and welcome to Sunway Eye Centre page. Today on our Get to Know Doctor series, I have with me is Dr. Umi Kalthum, the consultant ophthalmologist and cornea specialist here at Sunway Eye Centre. Hi doctor, how are you?
Hello, I'm good.
Okay, thank you for joining me today for a chit-chat session so that we can get to know you better.
Yeah.
Could you perhaps tell us or share a little bit of your background and your journey of becoming an ophthalmologist?
Okay, I'm from Johor and I spent a lot of my younger years over there. I went to a boarding school in Peking, Perak. So after matriculation, a year of matriculation in the UKM, I went to further my studies in Trinity College, Dublin, Ireland. So that's where I got my primary degree in medicine. So after about 5 years in medical school, I thought that it's a good idea if I could gain more experience in the working world. So I decided to work there and I worked in Dublin for about a year in the training hospitals that I went to. So at the end of the internship, I got married.
You got married in Malaysia?
I got married in Malaysia, of course. And my husband was trained in the UK. So both of us, we've seen quite a bit of that part of the world and we want to see the other side of the world. So both of us landed a job in New Zealand and I worked as a medical officer there for about a year. I enjoyed New Zealand. I find that the people are very nice. The place itself is very nice.
Is it quiet?
It could be, but in the hospital it can be quite busy. So I worked in North Island, in Waikato. At that point of time, much as I like New Zealand, I thought that it's time for us to settle down. And I have decided to do ophthalmology at that point of time. So we both went back to Malaysia. So I spent about 4 years doing my master's degree and finished off and became a full-fledged lecturer and ophthalmologist in 2011. I was doing a lot of general work at that point of time. I did gain a lot of experience doing different or various parts of ophthalmology before deciding to do cornea. So in 2014, I started to delve more into cornea and refractive, and then in 2015, I got accepted into a fellowship program at the University of British Columbia, Canada. I feel that I'm quite fortunate because University of British Columbia, Canada, they followed the US system. And all this while, my training has always been under the British system.
Yes.
Even in Malaysia, it was following the British system. So I feel that I'm quite fortunate and it gave me quite an experience seeing how people do things differently, not necessarily managing clinical cases, but the way they run the clinic, the way they
approach the
patients, it's quite different. So I came back in 2016 and continued on to become a consultant in UKM itself.
So from the many specialties, why did ophthalmology appeal the most to you?
It took me quite a while to hit the right spot, so to say, to choose what I want to do.
Yeah.
But I think I finally chose ophthalmology because I feel that it provides a good mixture of medicine and surgery. Like I like to see patients, I like to manage them in the clinical setting, but I do also like to do surgery. Secondly, I think that ophthalmology is quite pictorial. Like what you see as a lab results in other fields, for example, I can see the clinical changes. I find that is very fascinating for me. Thirdly, I think, and now even more so for me, I think that restoring vision in patients after cataract surgery, after refractive surgery, is such a fulfilling experience. That reason still holds true for me, even now that I'm doing the job and trying to give the best vision possible for different kind of patients.
Then can I know, throughout your journey, what has been the biggest challenge that you have faced?
As a working mother, I think that juggling motherhood and trying to give the best care for patients, regardless of the hours, the most challenging is trying to balance up. I do not know whether I've done the right thing always, but I feel that, and I'm sure that I've tried my best. I've given it my best shot. I've always had tremendous help from my family, and ultimately I always ask God for guidance, and in that case I'm very grateful to everybody.
I think every mother and for you as well, I think you will give the best and only the best for the children.
Yes, for sure, yeah. We try our best all the time. There's never a right or wrong because I feel that everyone has their own experiences. You know, each mother has their own experiences and different situation to live by, and I think we try to give the best shot we could in whatever situation you are.
Okay, that's an advice that I would keep from here.
Sure, yeah, I think it goes for everybody.
Okay, when you are not working, what are your hobbies?
Well, I like gardening. I plant veggies around the house.
Oh, nice.
I also like to read storybooks, not nothing related academically or anything like that. I enjoy thrillers and I enjoy fantasy as well. I do love
Completely
those
different.
Yes, something totally different from my field. Yeah.
Okay, before we end this session, do you have any advices for our dear viewers?
If you have any problems, if you have any doubt, or something happens to your eye, whether vision related or it's just redness, do come to see your eye specialist sooner rather than later. It's such an important thing. And take care out there, enjoy your life, and enjoy your good sight.
Thank you. Thank you, Doctor, for the great advices.
Thank you.
And I hope this will benefit our dear viewers. And
Sure.
also it does to me. I would like to say that thank you for joining the video. Stay tuned for our next video on our Get to Know Our Doctor series.